So good afternoon, good morning, everyone, depending on where you are. It's a pleasure for me to moderate this session regarding COVID-19 and the human rights of people living in poverty. We have an amazing panelist today, so we are really hoping to have a very good insights about this topic. I will welcome you all that are joining us through this webinar. I'm going to give you some few housekeeping issues first. First, I will invite all the audience to send questions in the Q&A facility and the buttons that you have in your Zoom. You can send the question anytime. We will be compiling the question and distributing to the speakers. I should also let you know that the webinar will be recorded, so all the co-sponsors can then disseminate. I would like to first of all thank you all the co-sponsors of this meeting: OHCHR, ATD Fourth World, Franciscan International, and the Global Initiative for Economic, Social and Cultural Rights. My name is Magdalena Sepulveda, and I'm the Executive Director of the Global Initiative for Economic, Social and Cultural Rights. So welcome to this Zoom. We are going to start with our first speaker, and our first speaker is Mr. Iyad Jaber, the counselor in charge of human rights for the mission, for the French mission to Geneva. Thank you very much. You have the floor.
Thank you very much. Can you hear me? It was not working. I just switched phones and it works, so I'm very happy. I just joined. Thank you very much for organizing. Let me first thank the organizers for the meeting, the Office of the High Commissioner for its very hard work and troubled times, and the attention given to the impacts of the crisis on the most vulnerable, and especially also the NGOs, ATD Carmonde, Global Initiative, and Franciscans International, among others, for their very valuable work in organizing this event, and all the other co-sponsors. I'm very honored to open this webinar on a subject that is very dear to my country, the fight against poverty. I'm doing it on behalf of my ambassador, who apologizes for not being here with us today, but unfortunately he is absent due to a very pressing personal matter. First of all, I would like to acknowledge the presence of Monsieur Olivier de Schutter, our new Special Rapporteur on Extreme Poverty. Monsieur de Schutter is a very important figure in the United Nations human rights mechanisms. As you probably all know, he previously served as Special Rapporteur on the right to food and was also a member of the Committee of Economic, Social and Cultural Rights. And his previous experiences make him a very strong ally, we believe, in reaching our goal to eradicate poverty by 2030. His presence here today also gives us the opportunity to learn more about his vision on how to reach this objective, SDG number 1, and to mitigate the negative impact of the COVID-19 crisis, the pandemic that we are all living today, on the poorest and the most vulnerable, who are the first victims of the crisis and all of its consequences, economic, health, etc. This is what also Monsieur de Schutter is proposing in his document related to the COVID-19. He also proposed a working method that aims to associate persons in extreme poverty to design and implement good practices that will help us to achieve the 2030 agenda, and we very much would like to hear him about his vision on all of that. My country, as you know, is a long-standing supporter for this mandate and has been working to eradicate the scourge of extreme poverty along with many others, of course. On the national level, we have a strategy adopted in 2018, a new one, to prevent and combat poverty. It focuses on a preventive logic on young people mostly, in order to break the vicious circle of poverty and provide equal opportunities from an early age to break the reproduction of poverty. Another aspect of the strategy is to work on the fundamental rights of children by combating their homelessness, and it's a phenomenon that is it is unfortunately still there. And finally, establishing training programs for young people under 18 to reduce youth unemployment. The main idea is to not let people enter the vicious circle of poverty, if that's possible. On multilateral forums, France has initiated with a transregional core group composed of 8 other countries, namely Albania, Belgium, Chile, Morocco, Peru, the Philippines, Romania, and Senegal, and some of them co-sponsored this event. The mandate of the Special Rapporteur on Extreme Poverty, it's, as you know, there's an initiative which was presented by our 9 countries during this 44th session that is still ongoing now, and it aims to renew and strengthen the mandate of the Special Rapporteur. The draft resolution, which will be hopefully adopted by the end of the week by consensus, is co-sponsored now by more than 58 states, and it shows how federative the issue is among the members of the international community and the members of the Human Rights Council. I don't want to take too long. I just want to thank you again for organizing. Welcome again the appointment of Monsieur de Schutter, and in the name of my country, encourage all states and stakeholders to work with him together in order to achieve our objective set for 2030. I thank you for your attention. Sorry for the technical complication at the beginning, and I hand over the mic to you. Thank you very much.
Thank you very much, Mr. Javert, for telling us what are the measures that France is taking to combat extreme poverty and to deal with COVID-19. Now it is my pleasure to introduce the UN Special Rapporteur on Extreme Poverty, Olivier de Schutter. Olivier, you have the floor.
Many thanks, Magdalena, and let me first of all thank Mr. Iyad Jaber for, on behalf of France, his introductory remarks. It's a great honor to step into this mandate, and it's a particular pleasure to have you, Magdalena, as a chair for this discussion, since you set a very high standard for this mandate when you yourself were in this role at the same time that I was working on the right to food. And I really look forward to collaborating with you and the Global Initiative on Economic, Social and Cultural Rights, just like we collaborated when we both were special rapporteurs back then. I would like to use the 4 to 8 minutes I have, and I shall probably not use the full 8 minutes, to go beyond what we have been saying until now concerning the impacts of COVID-19 on people in poverty and the need for states to be particularly attentive in the measures they adopt, not to burden further people in poverty with new obligations imposed on them, and instead to extend social protection in ways that can provide effective safeguards. What I would like to do is to introduce the work that a number of people have been preparing for the mandate, and that is not finished yet, but shall hopefully be presented at the end of this summer, perhaps in early September, reviewing a number of measures that states have taken in order to extend social protection, to adopt new social protection schemes, or to remove certain conditionalities that were previously attached to social protection schemes. What I would like to highlight is that although we have a large number of states who have adopted social protection initiatives in the light of the COVID-19 pandemic, altogether, 168 states have been reported to adopt such measures. 621 measures were adopted according to the count of the World Bank presented mid-June. What we find is that many countries still face serious challenges in order to ensure that extended social protection measures in response to the crisis shall effectively reach people in poverty. And I'd like to highlight 9 challenges in particular that we are documenting and that we are illustrating by a number of country examples. The first challenge is that many schemes that have been adopted or expanded by states include conditions that are maladapted to the realities of people living in poverty or those in precarious employment. For example, we have some countries who've adopted tax deferrals or refunds, but of course, those measures do not benefit those who are not required to file taxes simply because of their modest income. And for example, a measure adopted by Canada, the income tax deferral in response to the crisis, will not reach some 40% of Canadians because of this odd system in which those not paying taxes, of course, do not benefit from this support measure adopted in Canada. A second challenge is that many of the measures that have been adopted by states are of a short-term nature, of a contingent nature, often lasting the duration of the lockdowns, 3 months at most, relying sometimes on bills having to be adopted by Parliament in order to be renewed. And so the second challenge is to develop these social protection measures into standing rights-based social protection schemes that will be permanent in time. And that is certainly something that we all should be attentive to ensure that these temporary measures that are adopted contribute to realizing the commitment adopted in June 2012 when recommendation 202 on social protection floors was adopted within the ILO. And for the moment, most of the measures adopted are still of a short-term temporary nature. The third challenge is that many of the schemes that have been adopted find it difficult to reach effectively workers in the informal sector or workers in precarious, atypical forms of employment. And that concerns altogether 2 billion workers in the world, 1.6 billion in the informal sector, 400 million in precarious forms of employment, non-standard forms of employment, and very few of the schemes that have been adopted effectively reach them, particularly when these workers are self-employed and are not registered as a formal business. The fourth challenge is that although some countries have adopted schemes that also protect migrant workers that either are undocumented in the country or are there on a temporary basis, in many cases this is not the case. And for example, Australia has more than 1.1 million temporary workers on its territory, including asylum seekers on bridging visas, people on temporary protection in Australia with safe haven visas, and all these workers are not effectively protected by the measures adopted by Australia in order to respond to the crisis. In Australia, there are also some 50,000 to 100,000 undocumented migrants that are working in the informal sector in Australia. They too are not covered effectively by the measures that have been adopted. So that is the fourth challenge concerning migrant workers and particularly workers that are not documented. The fifth challenge is, of course, how these social protection measures shall be financed and whom shall pay, in fact, for the social protection measures that are adopted. Equitable financing is one of the major themes in the call for action adopted in 2019 by the USP 2030 partnership, Universal Social Protection 2030 partnership that ILO in particular is leading on. And it's extremely important not only to ask whom is protected by these new social protection schemes or these expanded social protection schemes, but also how they shall be paid for. If these schemes are paid for by increased VAT rates, by increased tax rates on the poorest households, that of course would be deeply problematic. It might worsen inequalities. It would result in a situation in which poor families pay themselves for the measures that should benefit them, and instead we should encourage financing of these schemes by progressive taxation measures and by clamping down on tax avoidance by transnational corporations in particular. The sixth challenge concerns the countries that do not have today the fiscal space required to effectively protect their population from the impacts of the poverty increases resulting from the COVID-19 crisis. Lebanon and Argentina, for example, have recently defaulted and restructured their debt. South Africa and Brazil have approached the IMF and the World Bank for additional loans. Many countries have sought from the IMF additional support, and indeed, the IMF and the World Bank have called for that reason for a suspension of debt payments from some 74 countries. And it's important to realize that today, although the contraction of the economy shall primarily affect OECD countries, developing countries and the least developed countries in particular face a number of shocks that make it extremely problematic for them to effectively continue to finance their social protection schemes. The fall of the price of commodities on which they depend, the increased burden of debt that is accelerated by capital flight from these countries, the loss of remittances, the loss of remittances that represented in 2019 some 550 billion US dollars, much more than all OEDA in the world. All this results in a situation in which these countries either shall not be able to protect their populations or shall see their external debt further increase. The seventh challenge is that so far, very few of the social protection schemes that have been adopted are effectively monitored by strong accountability or oversight schemes. And as a result, some cracks exist in the system that go unnoticed, and some low-income families are excluded from the systems put in place without the authorities being notified of this. And so it's extremely important that we strengthen the mechanisms that ensure accountability and monitoring of who actually benefits from the measures in place. The eighth challenge is that social services in all countries are now strained, overwhelmed with applications, and they must process many applications in short periods of time without having the capacity to do so. In the report we're preparing, we document, for example, the case of South Africa that showed that 21% of the companies in South Africa that normally should benefit from the temporary employee relief scheme payments were not benefiting because the system was simply unable to cope with the large amount of requests made, and there are other countries in this same situation. The ninth and final challenge is that many social protection measures and social assistance schemes are accessed through online applications, but many rural areas in the world have weak broadband access. Many people have low internet connectivity and low digital literacy, making it sometimes difficult for them to demand or claim the benefits they normally should have a right to. So these are 9 challenges that show that despite the very impressive, on paper, progress made in strengthening social protection in response to the COVID-19 crisis, in fact, people in poverty may be left out, and it shows the amplitude of the challenge we still are facing. And I'm glad to note that in response to a request made by the Friends of the Mandate on Extreme Poverty and Human Rights, led by France, I intend to present a report on these challenges early in the fall in order to draw the attention of governments on these potential gaps that may still go unnoticed. Many thanks indeed, and I'm sorry for having been so long.
Thank you very much, Olivier, for highlighting the challenges in this apparent extension in the coverage of social protection, but is still not reaching the poorest of the poor in different countries. Before giving the floor to the next speaker, I would like to thank the state's co-sponsor of this meeting. And these are very important states because they have been behind the mandate on extreme poverty and for a very long time. So I would like to thank France, Costa Rica, Belgium, and Peru for being the co-sponsor of this side event. So next, actually, I have the pleasure to give the floor to the Ambassador Shahra Duncan of Costa Rica, who will address us tonight. Shahra, you have the floor.
Thank you so much, Magdalena, for giving me the floor, and also to Mr. De Schutter for all the information that he just provided. Costa Rica has done and continues to do exceptional efforts to try to protect its population, especially those who are most vulnerable. It's no secret that the pandemic is having and will continue to have an enormous toll on the economy of the world, and in the case of Latin America, it's adding even more pressure to our systems. Right now, we're in the epicenter of cases. And in the case of Costa Rica, it found us in a rather complex economic situation already that actually required us to undergo fiscal reform last year, and it's already strained. In our case, it's also important to take into account that 20% of Costa Rica's workforce is in informality, and that the tourism industry produces 8.2% of the GDP of my country, and our borders have been closed since 18 March. The response measures have been taken considering at all times the protection of the most vulnerable populations and respect for human rights, and also keeping into account and having in mind the 2030 agenda, specifically the aim to leave no one behind. We consider that in these moments of global crisis, it is absolutely necessary that governments comply with their commitments on international human rights and our international human rights obligations. So starting Sunday, 8 March, when it was decided to raise the current health alert from green to yellow, the emergency operations centers began permanent coordination and the activation of thematic operating tables, allowing comprehensive attention to the situation and mobilizing resources on an institutional basis, interinstitutional basis. The instruction of the president was to take care of the most vulnerable people and to protect the country in its entirety. Actually, also asking for support from all patient care staff and calling to avoid manifestations of hatred and calling for the unity of the country, and reinforcing the message of citizen responsibility with regards to hand washing, sneezing, and the coughing protocol. In order to minimize the impact on the sectors that are most vulnerable to the pandemic, the government has developed 56 different measures that I will not go into detail today. But the aim is to protect priority individuals such as families, especially families that are led or headed by women, minors, people with disabilities, the elderly, indigenous peoples, people living in the streets, and families that are in poverty, and also population that is deprived of their freedom. So some of these measures are, we implemented something that is called Bono Proteger, which is a 3-month temporary financial aid that the government provides to people who lost their jobs or whose schedule was reduced, or their contracts were temporarily suspended, and are being economically affected by the emergency. So this is a 3-month transfer that the government is doing to these families, and the procedure to actually accede to these funds was actually very easy. People just needed an internet connection, and in Costa Rica we have a very broad access to internet through the mobile phones. Also, we have food at home strategy, which is basically the Sensinized, which are the institutions that provide food and care for children who need it. We are continuing to provide food services during the pandemic for children, for pregnant and lactating mothers enrolled throughout the country. So the Ministry of Public Education changed the modality modality of delivery of food in school canteens, and instead they're providing a food package that is given every 3 weeks to children from the public school system, including preschool, primary, and secondary, and also an adult population that are enrolled in primary education. Also, the Ministry of Public Education is implementing a strategy to make sure that all the kids have their right to education. It's called I Learn at Home. And we're trying to use technical resources and remote actions to support families to give them the material for learning and that the minors require. We have also coordinated with the Institute of Aqueducts and Sewers to have supply of water even in tanks where in some areas where water is not accessible. And we decided to suspend, as of March 20, any suspension due to late payment. So for now, everybody is ensured of their human right to water. Also, when it comes to women, we have been working to make with the National Institution for the Care of Women to make sure that women in conditions of vulnerability, violence against women, that this is taken care of, and that we're monitoring throughout the national territory using electronic means. We have also sustained and kept the subsidy transfers that are maintained throughout some of the programs that we have. For example, Bridge to Development, which is an initiative and a transfer that we give so that children remain in school. So even though they're not physically going to school, we continue to give this help to families so that they keep children off the streets and off the world of work. Another thing is that every woman with symptoms of or possible transmission of COVID-19 who does not have any insurance modality has the protection of the state to be attended in the health services of the Social Security system of Costa Rica. We are providing necessary care in our clinics and hospitals, and are establishing remote and virtual assistance, medical assistance to our citizens and in cases that, of course, allow this. And we're also distributing medicines so that the elderly don't have to leave their homes. So we have people from the institution going to the homes of the elderly to distribute the medicines. We also have contracted residential services for the abandoned population, and also that present symptoms, especially the elderly, and also for people who are living in the streets, that are in the streets, so that if they have the COVID-19 or any of the symptoms, they have a place to stay where they can actually take care of them. Also, this is also being done in certain places where it's not possible. Just 1 minute, okay. When it's not possible to provide them, to ensure the physical distancing and the quarantine that they need. Right now, we're for the elderly, we are continuing to give food to around 1,200 older adults, and we're continuing to provide care for 14,000 elderly people. And for indigenous populations, we have been developing technical guidelines for the prevention of COVID in their territories, in the 28 indigenous territories that we have in Costa Rica. And we have been also distributing hygiene and cleaning and protection articles for people who are in condition of living in the streets. And then lastly, I would like to mention when it comes to people that are populations that are deprived of liberty, we have been taking preventive measures to ensure that they have more contact with their families, even though that the visitation right now is not available because of sanitary reasons. But we have put more telephones so that they can actually have more access to their families. So for now, this would be my 2 cents.
Thank you very much, Ambassador Duncan. I would like to remind all the participants that you can use the question and answer button to send us questions to each participant. So try not to use so much the chat button, but the question and answer button for the question. I have the pleasure now to introduce our next speaker, Shahra Razavi, the Director of Social Protection of the ILO. Shahra, welcome to the panel. It's a pleasure to have you here.
Hello, good afternoon to everyone on this panel and everyone who's listening. And thank you, Magdalena, for the introduction. It's a real pleasure to be here. And I would like to thank OHCHR as well as the supporting governments who have made this panel possible. And it's a real honor and pleasure for me to be sharing this panel with the distinguished colleagues who are on the panel. So let me just sort of try and say a few words. I was asked to speak a little bit about the impact of the COVID crisis on people without social protection and how the lack of social protection has created increasing risks, and then a bit about the policy solutions. And I think many of the issues have already been addressed by previous speakers, but let me just give a little bird's eye view of where we are with this crisis. I think, we're all very aware that this crisis had its origins in a very different kind of crisis compared to, let's say, the global financial crisis of 2008, which erupted from within the financial system. This particular crisis, came as a result of a pandemic, and it's obviously the first time in modern economic history that governments actually consciously and deliberately brought down the economy, shut down much of the economy to protect sort of lives of people. However, despite its very specific origins, this crisis, like previous crises, did reveal the importance of having social protection systems in place that are comprehensive, and that when you don't have such systems in place, the consequences can be devastating. We know that something like only about 31% of the world's population enjoys comprehensive social protection, and the proportions are particularly low for women in terms of a global average, 27% of women compared to 34% of men. And we know also in the middle of a pandemic, that affected people's health, only something like 64% of the global population was affiliated to a publicly mandated program so that they could access affordable healthcare. And for the remaining nearly 40%, they would have to sort of pay out-of-pocket payments, which obviously can lead to financial ruin for many families. So this was, I think, a wake-up call in terms of how badly we are protecting our societies, ourselves, against any kind of sort of pandemic and health crises when affordability of healthcare becomes an issue. Also, in terms of sickness benefits, something that I think is relatively underdeveloped in many social protection systems, we only have about 62% of the labor force that has legal coverage in the world. And this is only talking about legal coverage. Effective coverage is obviously going to be much lower. And then without these sickness benefits, obviously a huge number of people have had to go out and work despite the risks to their own health and despite the risks to co-workers and the community. And if people are not able to access quality healthcare, then when they have symptoms, obviously they're not going to be able to seek healthcare. So I think in these very specific ways, the COVID-19 pandemic has really sent us the message very clearly that we're only as safe as the most vulnerable among us. And we need to worry if people in our community don't have healthcare coverage. It's not just about, protecting me and my family. We are living in a society and we cannot build walls around us. So I think that's a really important message in terms of what kind of social protection systems we build and really being able to act as a society and ensure the universality of coverage that is so critical for all societies. The economic consequences have also been devastating. I'm not going to cite all the figures about, you know, global growth and how it has contracted, the global economy has contracted, but really to give you a little glimpse into the human side of that, I think, you know, labor markets obviously have been hugely affected. And the latest ILO World of Work Monitor showed that the decline in working hours in the second quarter of 2020 relative to the last quarter of 2019 was about a 14% decline, equivalent to a loss of jobs of about 400 million full-time jobs. And yet, in the middle of this kind of devastation of labor markets, where people are being thrown out of work, we only have protection for 1 in 5 persons who are unemployed. They can receive unemployment benefits. The other 4 out of 5, 80%, basically have no income support to turn to. Now, unsurprisingly, the negative social consequences have been huge on issues of equality. We've seen a lot of princes and presidents and prime ministers get infected by this virus, as have many poor people. But that's kind of where the question of equality ends. From there on, in terms of who's able to access healthcare, who's able to have social protection and income support, whether you're able to isolate yourself and stay at home and have access through the internet, have your children attend classes, you know, we live in different worlds, obviously. And for many people, all of those things are not in place to enable a continuity of lives and livelihoods and enjoyment of rights. Now, on the gender issue in particular, I think it's really important to say the way in which women have been affected in a sort of triple way. In terms of employment, a larger proportion of women are working in sectors that have been severely affected by the crisis. And you can see this in the ILO monitor, which looks at where people are in terms of the sectors in which they work. Something like 40% of all employed women are in sectors that are very hard hit, compared to about 36% of men. But when you look at the regional averages, then the gender gaps are much larger. And I don't have time to give you the figures, but they are much larger. And overwhelming majority of workers in the health and social sectors we know have been women. So they haven't lost their jobs, but they've had to continue working under very difficult conditions without protective equipment and resources, and with understaffing, which is partially a result of years of austerity and underinvestment in health systems. And thirdly, we also see the way in which the crisis has thrown a lot of care needs back onto families and households, because, you know, creches have been closed. People who've had elderly relatives in care homes have had to take their dear ones back into the family because of all the health issues and concerns in long-term home care services. And this has meant, you know, a huge amount of work falling back on families. And we know that very often means women, because of the way in which unpaid care is unequally divided within families and households. Now, many of these disproportionate impacts on women could really undo some of the gains in gender equality that we've seen in labor markets and in societies over the past decades. So what is to be done? Where do we go? Now, obviously, you know, the crisis has been unprecedented, and the response in many ways has also been quite significant. And policymakers have responded to this double challenge of containing the health pandemic, while at the same time trying to deal with the recessionary crisis and the fact that, you know, jobs have been lost and the economy is in lockdown. It doesn't mean that every government has done a great job. You know, we know that the responses have been few and far between sometimes, not fast enough, not well enough. But there has been a lot of energy being spent in terms of trying to put measures in place. And I think Olivier referred to the kind of extraordinary social protection responses that we've seen over the past few months. And I think that response dispels this myth that the state is in retreat and irrelevant. I think we have rediscovered, if we've needed to rediscover, the importance of the state in putting in place social protection measures. And states have intervened very decisively. You cited, Olivier, some figures, I think, from the World Bank. The latest ILO social protection monitor that tracks measures, the 7th of July edition that came out last week, shows that 202 countries and territories have announced at least 1,205 social protection measures. This is great, and we're all celebrating it. But as Olivier said, many of these measures are short-term measures. Sometimes they only last for 3 months. It's great that some of them have extended coverage to people who are usually excluded, particularly workers who work in the informal economy, sometimes to migrants. But again, the fact that they're temporary measures means that's a gain that is, likely to be lost if there is not an effort to make these measures more permanent. And also very importantly, I want to emphasize the fiscal action has been significant by the G20 countries. They've spent about 4.5% of GDP on fiscal stimulus measures, throwing away some of the old rule books about how much you have to spend and deficit financing and the rules on that. But if only that kind of response was possible for many developing countries. And we know that has not been the case because of the many macroeconomic constraints against which they operate. Again, Olivier mentioned some of those problems with capital flight, loss of foreign exchange earnings because of loss of remittances and commodity prices going down, exports becoming difficult to move, and also the fact that they have to service huge debts. So because of those constraints, a proper response has really not been sufficiently forthcoming in many developing countries. So where do we stand? Where do we go from here? We are, I think, at a critical juncture in many ways. The average measures introduced for COVID were designed to last 3 months. What happens next is the big question. In the medium term, we really need to be ensuring that existing responses are sustained until the crisis is really abating and the economy recovers. We cannot see a premature sort of return to austerity. It would be suicidal in many ways, socially, for people's lives, but also economically by sending economies down through a further recession. And we really need to be thinking about how to, I think, leverage the kind of political momentum that we have and the widespread public and political realization of the importance of social protection systems to really move forward the promise of that recommendation 202 that was referred to, and to really build the kind of universal comprehensive social protection systems that we have. But austerity looms large as a concern, and I think this is something that a lot of people are very concerned about. Particularly, we have the huge fiscal gap in developing countries that needs to be reduced and addressed. I think in addition to ensuring the adequacy of emergency response, it's really necessary to develop a longer-term strategy for strengthening social protection systems and increasing our preparedness for the next crises, whether it's a pandemic or it's many of the other crises that are likely to come because of the existential threats from climate change. And the issues of fiscal austerity, responsibility and fiscal austerity, the risk of fiscal austerity cannot be emphasized enough. We need solidarity and equity in how we mobilize resources within countries, as was mentioned, through progressive wealth and income taxes and not regressive measures like VAT taxes. But we also need to think about solidarity at the global level. If one country is not able to contain the crisis, this is likely to reverberate across the world. So even if it is in terms of self-interest, we need to find mechanisms for making the global financial system enable developing countries to also mobilize resources and be able to invest in their social protection systems. I think that's really a big message that is coming out from this crisis. Seize the policy momentum that's unleashed by the COVID-19 wake-up call to accelerate building universal social protection systems, including floors nationally, and ensure that the global system enables every country to do that. Thank you very much, and sorry if I have taken more of your time than I had been allocated.
Thank you very much, Shahra. I will remind everyone that now I'm going to introduce our next speaker, Mr. Eric Assard, who is the West Africa representative of Save the Children. Eric, you have the floor.
Yeah, thanks a lot, Magdalena, and thanks for the invitation for the co-author of this important dialogue, and to Olivier de Schutter also. When we are looking about the COVID-19 impact on human rights of people living in poverty, based in West and Central Africa, in covering the whole continent from where I'm based, I've been looking at what has been some of the disparate impact of COVID-19 for children living in sub-Saharan Africa. Of course, like everywhere, COVID-19 pandemic has had a devastating social and economic impact. but it has been also putting African government in front of a Cornelian choice very quickly between the imperative of avoiding the spread of the pandemic and the urgency of responding to the needs of the most vulnerable by reviving the economy. Also, children do not represent an high-risk group for direct COVID-19 fatality. It is also important to assess the impact that COVID-19 had on children's rights. And I would be interested to look at 3 or 4 elements. The first one being the right to health. I think we have been elaborating already on this, but it is clear that in a continent, in a region, Sub-Saharan Africa, where 2 out of 3 people are living in extreme poverty, the rapid spread of the COVID-19 has not only overburdening some already under-resourced African health system, but it has been also participating to the disruption of routine health, which are likely also to increase disease incidence and deaths from preventable and treatable disease, especially for children. In a continent where when you are speaking about the cost of being treated and going to the hospital, you need to understand that 9 out of 10 people are paying the full cost out of their own pocket. This means that the capacity to continue to get access to the health system in a period where there was already a huge disruption of the system, but also a huge economic impact for the most vulnerable people. It has been very difficult for many people to continue to go to the hospital and any type of treatment center. In May 2020, in Uganda, the reporting rate in health management and information system was showing a drop between 50 to 80% of people coming to the hospital. And we have been observing very similar situation in many of the country. The other right I would like to look at is the right to education. When you are speaking about the right for children, it is obvious that the COVID-19 pandemic has been jeopardizing African children from learning. So we recently were discussing with some children across the continent, and we had this testimony from Renata, 18 years old girl living in Bobo Dioulasso, which is the 2nd largest city in Burkina Faso in Western Central Africa. And she was telling us that she was feeling very bad about the fact that the schools were closed during the COVID-19 because she couldn't go to the schools anymore and didn't know if she was able to resume the classes. She was also very scared when the school was closed because she's in an exam class and she was afraid that this year is being declared blank year and her not being able to continue to go to schools because she will be becoming a charge for a family. But Renata is just one of the over 262 million children which have out of primary and secondary schools because of the COVID-19. And when you are looking about the schools, school is not only securing the right to learn. School is also one place, and particularly for the many poor and vulnerable children in Africa, a place which is considered as a safe place when you are protecting from different type of violence and different type of exploitation. We should not forget that after the Ebola crisis in 2014-2015, the number of adolescent pregnancy have been dramatically increased. And in many of the countries, when you're adolescent and you're pregnant adolescent, you are not allowed to continue to go to schools anymore. That's a sad reality. So this means that your future is totally undermined and stuck. Only in a country like Sierra Leone, at the end of the Ebola crisis, it has been recording an increase of 11,000 teenage pregnancy. But school is also a place where you can get access to your nutritious meal. In East and Southern Africa, I think the WFP World Food Programme, which have been estimating that 3.5 million are not longer receiving schools meal due to the schools closure. So what does that mean? And what does that mean in terms of the third right, which is the right to food? We all know that Sub-Saharan Africa has been facing a lot of type of food crisis driven by climate change, conflict, economic challenges, and so on. But the recent estimate of food insecurity suggests that as many as 107 million people in Sub-Saharan Africa are currently acutely food insecure. This number has been doubling in Sahel, or the number of people facing food insecurity has been doubling in the Sahel region compared to December 2019. Currently in Horn of Africa, they are facing another low-cost outbreak, and the latest APC report is showing that for a country like Sudan, extreme hunger will double to 1.1 million children, currently, which is exactly the double number compared to 2019. So what does that mean in a region where many of the response plans are highly dependent of the international capacity to support them, and on average, a humanitarian response plan are funding only by half of the need, and so cannot meet the needs and the growing needs that we are facing in the region. But the fourth right I would like to look at how this COVID-19 has been impacting the right to children is the right to protection. It is clear that this pandemic has been just exacerbating the existing vulnerability. This pandemic has a catastrophic impact for the most vulnerable who do not have access to any type of social protection. That's the case of all the street children. That's the case of all the internally displaced people. That's the case of the refugee who are not only exposed to an higher sanitary risk, but who are also facing higher limitation to get access to health and alternative system and so on. So in this context, for professionals which have been working in development sector in Africa for over 20 years, I've been very pleased in many ways to see that there have been some of the political leadership across the continent. The best example coming from the education sector, where we did see the government and the education community coming together to set up some innovative way to provide learning program on radio, TV, and so on. A very good example is Ghana, which have been able to provide a learning TV access to close to 1 million high school students to continue their education. But what does that mean? In a continent, in a region where 89% of the learners do not have access to household computer, or 82% of the learners do not have access to internet. So it means that a large part of the learner, a large part of the student have not been able to continue to learn this last couple of months. We have been seeing also some very interesting and progressive or progress made in some country. For example, to respond to the fear of Kadiatu, which is a 17-year-old girl living in Freetown in Sierra Leone, who had to drop out of schools after Ebola because she has been sexually abused and become pregnant. Recently, on March 30, the government of Sierra Leone, to its Ministry of Basic and Senior Secondary Education, announced that the 2010 government decision to prevent pregnant girls from attending schools were overturned. I think that's a very interesting progress which has been done, but how we can disseminate that beyond the crisis and how we can make sure that it can be disseminating also in few other countries across the continent. In few countries, some children here, they have been taken away from the street to be reunited with their family. But the scale of the response to protect street children, IDP and refugee remain very modest in a region which hosts more than a quarter of world refugee population and an estimated 18 million displaced people. So in this context, I think a lot of things has been done. And there is a recent analysis from one of my friends, Mark Vigorif, which is a lecturer at the University of Pretoria, which is explaining how informal food traders who have been suffering from the crisis, who also do not have any type of social scheme, could have been able to maintain a food system in place to respond to the food needs in South Africa, and also benefiting to maintain and continue their whole business, but unfortunately have not been integrating in the government's COVID response plan. So which is also one of the difficulties that Olivier was mentioning earlier, which is how do we recognize this informal sector in all the response plans that has been put in place. So I think to conclude, I would say that many African governments so far have been taking quick and decisive leadership in managing the COVID-19 pandemic with the support of the international community. It could certainly set the path for greater government ownership and assertion of control of emergency and future crises within the border in the near future. But I think to be able to respond and to continue to respond to this crisis, I think that's going to be important to ensure that in a continent like Africa, all the decisions will be taken will really be aligned with the international and continental commitment to child rights and well-being. And in particularly in a year where we are going to celebrate the 30th anniversary of the African Charter on the Right and Welfare of the Child, I think there are certainly 4 elements which could help us to continue to go in the right direction. Make sure that in the response, in the current response, we can preserve the children's rights through granting access to quality health education and protection services. Ensure also that in each of the current response plans in a continent which is still affected by COVID-19, we will continue, the plans will be driven by the best interests of the child and the do not harm principle. but also, certainly most important, recognize in those plans the specific needs of the most vulnerable children, which in large way have not really been integrating in the existing continental and national plan. But all of that, if it's not supporting by the development and the implementation of permanent social protection system and mechanism and policy in a country, in a continent where 9 out of 10 people do not have any type of social protection mechanism, there is a lot to bet that they will have no impact in the near future, and the future crisis will be at the same, will have the same impact for the poorest people. Thanks a lot.
Thank you very much, Eric. Now, last but not least, our last speaker, Maryann Broxton, who is the research coordinator of HRC Fourth World USA. Maryann, you have the floor.
Wonderful, thank you so much. And actually, I just want to correct, coordinator for a research project that we did, not all of HRC Fourth World. Good morning, and thank you for inviting me to take part in this dialogue, and good afternoon also, depending on where you are today. I thought a lot about what I wanted to share with you today in relation to COVID-19, poverty, risk factors, and who is most affected. And the deeper that I went, the more I kept coming back to the same few points: choice, worth, and accountability. When we talk about eradicating poverty or even alleviating poverty, we tend to talk a lot about the lack of political will, but that's misleading. Poverty doesn't simply exist because of lack of political will. In our world today, poverty exists because of deliberate political choices. Poverty doesn't affect vulnerable people like a natural disaster. Poverty is man-made. You know, people are marginalized based on their perceived worth or lack thereof in a specific cultural and social environment, and are pushed into poverty. This virus just followed the path that was resulting from this push and getting into the cracks, and in some instances, the wide open gaps in our society. The risk factors for COVID-19 infection for people living in poverty have been designed by political choice and institutionalized based on the perceived worth of people long before this virus. So nothing new or surprising. We already know that where you live, the area that you live in, will determine everything in your life. The food you eat, the housing you do or don't have, the quality of your children's education, or if they even receive an education, the type of job you can have, or if you have a formal employment at all, the access to and the quality of your health care, and the level and even the quality of the air and water you breathe and the water you drink. It even determines your life expectancy. We know that children born into these areas will most likely grow up into poverty, as their parents did before them, due to restricted opportunities, enforcing generational poverty. We know that people of color are overrepresented in the poverty population. And I want to say right here, when I say the term people of color, intentionally, to recognize Black, Indigenous, Hispanic, Latinx, Asian, and Pacific Islanders as it unites all people in the work for justice, but also acknowledging that not all people of color face the same levels of injustice. People of color face segregation, institutional and environmental racism, housing and employment discrimination, and a racial wealth gap. That having everything to do with racism, not race itself. I was going to speak a little bit about women, but Ms. Razavi and Ms. Duncan have done so eloquently. So the point that I would like to add or stress is also the imbalanced weight of parental guilt that women bear, along with the extra added workload of their communities and their families. As primary caregivers, it's often women who go without food to ensure that their children are less hungry. They go without the basic necessities to ensure that children don't. And all this while enduring this shame society places upon them due to their level of poverty. And we know that the intersection of racism and gender compound all of this for people. In the US, pre-COVID-19, there were 1.8 million households with access to running water. Over 39 million people lived in poverty, and 37 million experienced hunger or food insecurity. African Americans made up 13% of the US population, but represented 40% of people experiencing homelessness. And that number increased to 50% for Black families with children. 1/3 of the requests for money on the GoFundMe app in this country were to cover medical expenses. In Boston, where I live, there's 2 neighborhoods. Roxbury, a mainly low-income majority people of color area, and Back Bay, a more affluent majority white area. They are less than 4 miles or 6 kilometers apart, but they have a life expectancy difference of 30 years between these 2 neighborhoods in one city. When it was discovered that people with pre-existing health conditions are more susceptible to the virus, like high blood pressure or diabetes too, which disproportionately affects people of color, they were blamed for their eating habits, opposed to acknowledging the quality of food that they have access to. One state lawmaker in the US even questioned if Black people were more susceptible to the virus because they didn't wash their hands as well as white people. You know, hospitals are now debating on activating what's known as crisis standard of care, meaning they have more flexibility in allocating resources that could potentially result in an able-bodied person being offered a ventilator over a person with intellectual or physical disabilities. And I mention all of this because the US is a wealthy, developed country, but this is true regardless of where you live. These conditions existed long before COVID-19 because of deliberate political choices. These choices became justified when specific groups are most affected are perceived as unworthy or of equality and assistance based on discrimination. The sexism, racism, xenophobia, ableism, and all the stereotypes that go along with it, that they have a direct effect on people and can even predict the level and depth of poverty that a person experiences. COVID-19 may have exposed the cracks in the system for a larger society, and some even for the very first time, but people living in poverty, they have been always there, you know, enforcing the inequality that has been part of their daily lives. And we're seeing it now as we play out, as we see who is the most affected by this virus. I know the attendees will soon be asking my fellow panelists and myself some questions, and I look forward to them. But I also think there are some serious questions we should ask ourselves that center around what are the choices we are willing to make? Will we base them on equity and inclusion opposed to perceived worth? And will we demand accountability? As people around the world are struggling to feed and shelter their children due to COVID, others have been making millions of dollars off of it because it was a choice to prop up corporations and businesses opposed to people. Will we make the choice to commit to the massive influx of money that we know is needed to ensure that people come out of the other side of this pandemic hole? And although money is nice, we know that poverty is more than just about lack of money. You know, it's multidimensional. It's where you live, your access to housing, education, food, employment, healthcare. But it's also more than just the things that are easily quantifiable, like employment and healthcare. It's about shame and stigma, isolation, the unrecognized voice and exclusion from participation. It's about purposely being denied control and power over your own choices in life. You know, are we willing to correct the desperate impact of previous choices? Okay, I have 1 minute, but I'll try to speak up faster. Are we willing to correct the desperate impact of previous choices by committing to the fact that people are worthy simply because they are human, not just with our words, but also with our actions? Are we willing to stop seeing people in poverty as convenient to disparage, believing it's permissible or accountable because those people are the fringe population, have character flaws, and are not commonly share morals with us and are not part of our community? You know, people in poverty are constantly held accountable for their level of poverty as if their personal choices and actions alone are responsible for it. But governments are never held accountable for the deliberate choices that push people into and maintains poverty. If we pledge to leave no one behind, there needs to be accountability to ensure we achieve that pledge. One of the representatives from my state says, the people closest to the pain should be closest to the power. Are we willing to share that space and power to ensure best practices by including people with the hardest experiences of poverty as legitimate, equal partners whose voices and input carry as much weight in those traditionally looked at for solutions in the decision-making process and critical review? And if they are not there right alongside you in these processes, will you demand that they be there? You know, this is what HRC44 has been doing for 60 years worldwide. And it's how we were able to do the research project internationally in 6 different countries. And it's why I, a woman with a direct experience of poverty, was chosen as one of the coordinators for this research project, because it can be done and it works. And I'd like to conclude my thoughts today by saying the one thing that COVID-19 has done extremely well is demonstrating that how much our well-being is tied together. You know, I will be okay if a person living in Madagascar is okay. They will only be okay if a person in Germany is okay, and they'll be okay if a person in Bolivia is okay, and on and on. It's not about charity. It's about mutuality. Believing that the person next door to you or that the person around halfway around the world has just as much right to equity, dignity, and well-being as you do. And that is how we make deliberate choices needed to recover from COVID-19 and poverty in general. Thank you for your time and your attention.
Thank you very much, Maryann. And I thank you all the presenters for these insightful presentations. We have received several, the audience is also very active. We have received several questions. I'm going to reaggregate some of them. And we're going to now go to the second part of the webinar in which the presenters are going to respond to the presentation. So the first group of questions are related to women's rights and gender. So we have a couple of questions regarding if there is any approach to invest in new social protection program now, particularly for women's workers, in particular, for example, the ready-made garment sector, where hugely layoffs are being anticipated. There's also questions regarding the how to make social protection measures be responsive to care needs and unpaid care burdens without reinforcing gender stereotypes. Are there any good examples out there? So I might put these questions first to Shahra Razavi and then open to other presenters if they want to complement or to add. And then I'm going to move to the second round of questions. We have several. Shahra, would you like to respond first to these questions?
Thank you, Magdalena. I'll have a go, but I certainly don't have a monopoly over answers on gender questions, as there are several colleagues here who have all worked on the issue, and I hope they will come in and complement what I have to say. So just on the ready-made garment sector, obviously, I mean, this has been in several countries a really important sort of generator of employment for women who would have otherwise, I mean, I know like in Bangladesh, many of the women who entered into ready-made garment sector, you know, did so because it created an alternative to other kinds of employment, whether it was a self-employment in the agrarian sector or paid domestic work. So it was really seen as a way of upward mobility for a group of women, particularly those who came from rural areas. And in terms of what's happened, it's been devastating. The kind of loss of jobs in countries like Cambodia, Indonesia, Myanmar, Ethiopia, Bangladesh, Haiti, Indonesia. There is some efforts that are going on with support from bilateral donors, in particular Germany, and I know that our ILO colleagues have been involved in that, in being able to provide some wage subsidies, at least in, for example, in Bangladesh and I believe Ethiopia as well, and Indonesia, which would be something like 50% of a minimum wage that would at least be able to retain some of these workers. But the period is really short. The problem is it's been for like 2 months, and then what's going to happen after that if these industries are not resuscitated and are not able to provide, you know, work conditions and wages? So that's a really big question, and I'm glad that the issue was raised. On the gender responsive sort of social protection measures, there's obviously a lot that we can say from before the COVID crisis as well, particularly in the way in which some Latin American countries put in place sort of care credits within their pension systems that recognized when women had time off, for example, for care-related reasons, so they would not be penalized within a contributory pension system. I think that's a very good example of a measure that can kind of create a level playing field for women and men. But also very importantly, moving forward, I think, from this crisis, and the fact that we need to really recreate and invest in sectors that are both ecologically positive, but also good for human capabilities. We have huge deficit in terms of number of people who work in the healthcare sector. We also have huge deficits in terms of care services, you know, childcare services, long-term care services. So these are investments that, if they're made and if jobs are created, and there's some really interesting work that has been done by people, for example, in the UK Women's Budget Group, who have actually studied the number of jobs that can be created if you invest, you know, X percentage of dollars in the care sector. So you create the sort of care needs and you address the care needs. You also create employment, and it's employment in a sector that is, you know, not polluting, and it's human capability enhancing. UN Women has also done, I think, really good work in terms of capturing doing simulations and showing the kind of number of jobs that can be created, and the way in which, if these jobs are decent jobs, you can also recuperate something like, you know, 30–40% of the initial fiscal outlay through the sort of tax and transfer system, and also the multiplier ways in which the jobs can create you know, other sets of jobs in the economy. I think there's some really interesting sort of research going on there, which one hopes that can be gotten some hearing in the policy debates in terms of shifting economies towards sectors that can be job creating, but also good for people and good for the environment. So I think the care sector is definitely one area that should receive attention. And in the ILO, we're also developing tools in terms of costing of how much it would cost to invest in care systems. And there is also the big ILO care report, which also has a wealth of information on that. So let me stop here and hand over to other panelists for their additions and complement whatever they would like to add to this.
Thank you, Shahra. Is any of the other speakers would like to complement, or should I move to the next question? I will wait for your reactions. Olivier, you have the floor.
Many thanks. I very briefly would like to react to this very important question by responding to one sub-question that was asked concerning the risk of reinforcing gender stereotypes when addressing the particular situation that women face in a context in which in many countries, in fact in almost all countries, they still assume a disproportionate proportion of the care, unpaid, unrecognized care work. I think it's a real dilemma for many policymakers. And if we take, for example, the various conditional social protection schemes that provide support to low-income families, going to women in many cases, specifically following the example of Bolsa Familia in Brazil, but upon the condition that the children are, vaccinated and go to school and so on, it imposes on women, the beneficiaries of that kind of support, the burden of making sure that the kids are adequately taken care of. And that is reinforcing gender stereotypes. It is a problem. So I think what's important is to adopt a framework in which we do recognize the specific burden that women shoulder, but we at the same time try to relieve the women from these burdens, for example, by strengthening public services and ensuring that childcare services from the earliest stage are available and so on. And thirdly, we try to redistribute within households the tasks between women and men, between husbands and wives, between the partners. And this framework, recognition, relief, redistribution, is I think what we must use in order to overcome the risk of reinforcing gender stereotypes at the same time that we pretend to support women's particular role.
Eric, you have the floor.
Yes, thanks, Magdalena. I'm going to be short, but I just would like to put also the emphasis on some of the country trying to do having some progressive law and progressive policy. And taking the example of Burkina Faso, one of the, let's say, poorest countries in the world, who a few years ago I've been trying to put in place a universal health coverage system, but they was not capable to do so. So instead of putting the whole system in place, I've been starting, the first step was really to say, okay, let's target the pregnant woman and the under 5 and give us some free access to a specific package to make sure that they won't fall into poverty when they will be in a pregnant period. And I think it was very interesting to see what has been the impact in terms of reducing mortality of the pregnant women, but also reducing mortality of under 5, which was more or less an half of the overall mortality of the country. This has been led by the country. It has been developed by the government of Burkina Faso, but very quickly the capacity of the government was too limited to be able to make it sustainable. And I think this is where we still need to work on the coherence of the international aid and the capacity, or the agenda around Accra and alignment of aid and so on, where very quickly, unfortunately, many of the donors which were supporting Burkina Faso have not been supporting the government in this effort, which means that it has been reduced and not being able to go to the next level, which is enlarge that to a wider public. So I think there is certainly some things to be done at the domestic level, but how the question of the solidarity that I think Maryann was saying earlier, she was saying people are not asking for charities, they are asking for mutuality. And I think that's really a critical element of the solidarity agendas that we need to be able to put in place if we want to put in place some social protection mechanisms and skills which are really responding to the needs of the people in their own context. Thanks.
Thank you. Maryann, would you like to add?
Yes, sorry, I had to find my unmute button. The one thing that I agree we need childcare if we want to have women to be able to realize their full potential by going out and work and education and all that. The only thing that worries me is that usually childcare work is perceived as unskilled labor, so therefore it receives less pay. And we start that whole system again, and it's usually done, majority of childcare work, even in formal childcare settings, is done by women. So although we will be, increasing employment for some women, we're still giving them low wage work. And with COVID, we're seeing how people that are low wage workers are being treated. The idea that before was always, oh, well, that's unskilled labor, anybody can do that. But now we're deeming them as essential workers and they're important. But we're showing that as praise, as in with words, because they're still having to face the choices that a lot of us have privilege that we don't have to face. Like, it's not, okay, do I risk going out and getting sick and maybe dying, or bringing it home and getting my children sick and my family sick? Or do I risk not being able to feed my children or pay my rent or my mortgage or all these other things? So childcare workers are now essential. They're still low-paid workers, and they're still facing hard challenges that they had before, but now they can have a deadly consequence. So that's my feel. Like, yes, we need childcare, but we have to value that work with pay equity and living wages just as much as any other work opportunities that are there, opposed to creating another cycle of women that are in low wage work. So thank you.
Thank you very much, Maryann. Shahra, would you like to add briefly?
Yeah, I just want to thank Mariana. I think raised a really important point, like everything else she said before that as well, which I thought was really very interesting. But there's a whole kind of literature in feminist economics which sort of looks at wages of different kinds of workers. And yes, care work has what they call a care penalty. So if, like, the way economists like to control everything, if you control number of years of experience, education, human cap, all kinds of factors that go into human capital, there is a penalty for doing work in the care sector. So we basically reward people who work with machines and things, and we penalize those who work with people. And within the care sector, I think there are penalties in particular for those who do long-term care, elderly care work. So there's even a greater hierarchy and greater penalty there, particularly also because it attracts often women of color, migrant women. So you really do have these incredible hierarchies and different forms of discrimination that we now really need to address, especially now that we're recognizing all of this as essential work. So thank you so much for raising that point.
Thank you very much. I'm going to go to the next round of questions. Here we have another question. It's what measures has been taken to assist those who are homeless or who live in informal settlements, especially given that many of the conventional safety measures such as social distancing and regular hand washings are extremely difficult for this group? And another question is, have these measures been successful, effective, given the ongoing struggle that many developing countries have faced for decades when it comes to housing provision? I don't know who of the panelists would like to have the first go to answer that question. Ambassador, you have the floor.
Thank you so much, and thank you for this question. This is certainly one of the greatest challenges that we have had. I think that ensuring, I mean, we have to acknowledge that not all of us can actually maintain social distancing in the same way. That is for sure. The social distancing doesn't look the same for all of us, unfortunately. And also there is the challenge of all these people that have to go out to work because if not, they cannot provide for their families. So you have the informal workers that have been very, very much affected. And you have people living in areas where it's impossible to keep their distance. What we're doing, specifically in this case, is that we have the people from the social security system going into these areas to do as many as possible. Oh my God, I forgot the question. I forgot the term in English, tamizaje. Okay, to do as many tests for COVID as possible, to be able to contain the contagion and also to provide these people for safe space. So we have had or worked out with some hotels the possibility of taking people who are sick and that cannot stay at home because they don't have the conditions and be put in these places where they can actually have a space to ensure that they are in a good place, because not everybody can be put on hospitals, of course. So this is one of the things that we have been doing. We have been doing this also with people that are living in the streets and with the elderly that are in conditions of abandonment. And so you have the medical follow-up, and they are provided with food, and these are some of the efforts that Costa Rica is doing in this particular area. And taking into consideration also that if the greater good of the whole society, right? Right now we have there is a discourse in social media, and people are angry and frustrated, and there are people that are calling for, you know, not attending to others who are in need. And this is actually a time for real solidarity and for the state to really take action, because if not, this would only make the crisis worse for everyone, not only for the people who are affected, but for everyone else, and for the country as a whole. So those would be my 2 cents.
Thank you, Eric.
Yes, thanks. I think it's two elements. One, as I was mentioning in my introduction earlier, in the country where I'm living, in Senegal, there have been an effort to try to take away some of the children from the street, which unfortunately are already back, even if we are still in the middle of the crisis. So I think it's good to see the effort which have been done, but unfortunately, I would say that this effort has been able to reach a maximum of 5% of the children living in the street. I think no more than 3,000 children have been certainly reunited with their family during that period. And the support which have been providing to the children to make sure that they can stay in their family in the long term has not been providing neither. So in that sense, I think that if many effort has been done by the government, as I was saying earlier, the most vulnerable people have certainly in many ways been forgotten, or when we have been trying to accompany them, we have not necessarily been able to do that and to respond at the scale of the needs. On another note, when we are looking about refugee, internet displaced people, and migrant at risk, you can see that even in progressive country like a country like Uganda, which has the largest refugee population across the continent, with close to 1.4 million refugee and asylum seeker, the government has first been taking some decision really to try to limit all the movement for refugees, suspending all the new arrival for a period of 30 days and so on. And by restricting this movement to try to respond to an health crisis, in many ways, they have been also impairing the right of this asylum seeker or this refugee and internet displaced people, who are also some people who need to be able to get their daily wages based on the capacity to go out of the camp and being able to have some small work here and there to be able to get their meal and their food and so on. So I think if there is really one area where the government across the continent, based on the knowledge I do have, should have been able to do more and better, it's the capacity to really target the people who have been the most impacted by this crisis. And once again, they are the most vulnerable. So when I was saying at the beginning that the crisis has been exacerbating the vulnerabilities, yes, we are all equal vis-a-vis, in some way we are all equal, because the COVID-19 can infect anybody, and we have been seeing that. But at the same time, many of us are totally unequal in the sense that they are not protecting in the same way. They cannot continue to get access to their daily needs. They cannot continue to get access to their daily wage and so on. So in that sense, I think there is a big work that need to continue to be done, because we are still in the middle of the crisis in many of the countries in the continent. Thanks. You are on mute, Magdalena.
We are coming to an end of the meeting. I know that some of the panelists need to go to other engagement. So I think that we will need to leave it here. What I'm going to do is that we have very good questions. I'm going to distribute these questions to the panelists. Many of them also have the name of who sent it. So you're going to be, the panelists are going to be receiving these questions. I'm just going to, for those who can still, if the panelists would like to close in 1 minute, no more, just to close down, and then we can close the panel. Most of you have also looked at the questions, so if you want to address some of them in your 1 minute, it will be great. So I'm going to start in the reverse order that we did it the first time. So Maryann, you have the floor for 1 minute.
Okay, thank you. I'll try to be quick. The one thing I would really like to stress more than anything is participation. Because if we, like I said, we know all these things existed, and the type of recovery that we are going to have depends on who is included. Because people with the lived experience of poverty know how policy work in actuality, opposed to how it's supposed to work. For example, so if we were creating policy about women's issues, we would never have an all-male panel, or we would object to that and say, no, this is not the way it should be done. But when we talk about poverty, we contact statisticians and academics and economists and all of these people to give an overview. But except for the people that are like living this every day and can tell you exactly why. They're smart enough, they're intelligent enough, they have ideas. This is, and like I said, this is how we did our research for global research on the dimensions of poverty. And it changed it because it got so much down deeper into the actual dimensions of what people experience and what people go through. And if you want to be able to recover, it has to be participation, equal participation, all from beginning to end, for critical review, implementation, decision process, and that's how we do it. Thank you.
Thank you very much. Eric, you have the floor.
Yes, thanks. I think in many ways I would like to support what has been said by Maryann, because I think the participation is a critical element, making sure that we can hear the voice of the people who are living in this condition every day is certainly the best way to understand the situation, but also the needs, but also the solution, because many of the solutions are already happening. But it should force us, and particularly our government, to change the lens they are looking at this issue, because in many ways they continue to look at this to identify the needs, but forget those people who are maybe vulnerable, marginalized, when we are looking about the type of response we need to look at to respond to the needs. So I think there is certainly a need to change a bit the paradigms in the way we are developing the current policy, making sure that the policy are much more participatory, and making sure that the policy are really better integrating not only the needs, but also the type of response which are already happening on the ground. From being sitting in African continent for over 20 years, I think that all this work won't necessarily be done without the support of the international community in many ways, but not the international community being sitting in the lead seat, but being there to support and to accompany some country who are already facing some very severe and very drastic reduction of their own capacity in the coming months. So that would be my two pledges. Thanks.
Thank you very much. Ambassador Duncan.
Thank you so much. Well, I think that building up on what Eric has just said, on something that he has just said, we need to bear in mind that this is actually a global pandemic, and it really does require global efforts. I don't think there is one country in this world that can do this by themselves, even if it's sharing of experiences, sharing of best practices, cooperation, South cooperation. We all have something to learn from others. And that is why I think this exercise and other exercises like this are so important, because we can actually hear from the experiences of others and adapt to our own realities. And thank you very much for inviting me again and for taking Costa Rica into consideration for participating today.
Thank you very much. Olivier, you have the last intervention.
Thank you, but you'll have the last word, Magdalena. Look, I'd like to thank you all. I think we have for many years, and we still are, emphasizing the need to move from a charity-based approach to a rights-based approach, in which people have entitlements they can claim before independent bodies in order to make sure they're not excluded from social protection schemes. And I think what we heard today is that we need also to move from rights on paper to rights in practice. We heard about the invisible poor, women, migrants, homeless people, people who fall between the cracks because they are not participating in designing the system, and because when they are excluded, no one seems to notice, and certainly not the authorities in charge of designing and implementing the programs. So I think this is what connects the effectiveness of rights to participation. And I would like to thank, well, all panelists for their excellent contributions to highlighting this. I think those 600 or 1,000 social protection measures that have been adopted by 200 states are extremely important, but the test is, shall they really reach people in poverty without documentation, without a home, without a connection that allows them to be informed about their rights? And that is what in my next few, in the next few months, I shall be focusing on in this work on COVID-19. Thank you.
Thank you very much, Olivier. Thank you very much to all the panelists. We have a very interesting presentations, very insightful. I'm going to be very brief. We already lost one of the panelists that had another meeting. So I would like to just finally thank the government of Belgium, Costa Rica, France, and Peru for being the co-sponsor of this meeting, together with HRC44 Walls and Franciscan International. We all join this initiative. Thank you all of you who participated. We have a very large number of participants in this webinar today, and we will be distributing the questions to the panelists. So rest assured that they will receive your question. Thank you very much to all. Thank you for participating in this webinar. Goodbye.